We looked at the challenges facing Galveston County and saw a unique opportunity to drastically improve our justice system and increase our mental health care responsiveness.
Our community, up until this point, our crisis continuum of care has been either release someone in the community to our ERs, to our jails, or inpatient in Houston. So this facility will bring crisis access to help fill a crucial gap within our community. Those individuals that don't need to access those higher levels of care, those intensive levels of care, which would be our ERs, or going to jail, which is not the appropriate place for someone that's experiencing a mental health crisis. Between our extended observation unit and our crisis respite, we'll have access to 20 beds. So our law enforcement teams will not have to drive someone into Houston that's experiencing a crisis within our community.
We'd have to go back to 2017 when we commissioned a study of our criminal justice system. One of the things that popped out to us during that time was mental health. How many people from mental health pass through our jail system, pass through our criminal justice system. So we started looking at ways that we could better serve those people with mental health issues. And now we're at the point where it's time for us to open up an extended observation unit. And for that funding, the Commissioner's Court has been very generous in providing the funding to get the construction done. We got the legislature to allocate $8 million over the next biennium for that extended observation unit, and here we are now.
Something that most people don't recognize is that the state of Texas has made a huge commitment over the years to addressing the challenge of mental health. And in fact, in the budget for the next 2 years, over $9 billion through a whole variety of strategies, it has been appropriated for mental health strategies for a whole number of items throughout the state. And that's everything from the types of things we're talking about in Galveston County, to our state hospitals, to a child and adolescent mental health consortium, so that we can really meet people and hopefully intervene early and get them on a path to being productive contributors to society. There was a very, very important victory that speaks to really a plan that Galveston County with the Commissioner's Court and Judge Henry have been working on for years. And that is to help people that are experiencing a mental health crisis not have to interact exclusively with law enforcement or in the emergency room, but rather in an appropriate setting with people who can actually address the problem that they have. And so what we've done is we've partnered with the county and the Gulf Coast Center, and the state will be contributing $4 million each of the next 2 years for an extended observation unit that will help to get people the care that they need, get them out of the emergency room, which is a much more expensive place for them to be, and also help decrease the crowding of our jails with people who are not a threat and don't need to be in jail but need mental health services. So it gets the people to the right place and it saves the taxpayer a lot of money.
This is the culmination of years of hard work and dedication. The investments made by Commissioner's Court and now the state of Texas are changing the landscape of mental health care in Galveston County. We are truly at the forefront of innovation and problem solving at the county level.